Hello, thank you for joining us today for a topic that's been in the news quite a bit recently, and that is the resurgence of measles. I'm Allison Perry. I'm the Director of Public Relations for UK HealthCare, and I am joined today by Dr. Nicholas Van Sickels. He is an infectious disease specialist and the Medical Director for Infection Prevention and Control at UK HealthCare. So he's graciously given us some of his time out of his busy schedule just to answer some questions about measles for the UK community and beyond. So Dr. Van Sickels, thank you so much for being here.
Well, thank you so much for having me. It's a really important topic and one that we're trying to spread much more awareness about as we've seen more cases, especially across the South United States.
Okay, so let's get started. What is measles?
Yeah, that's a great question. You know, it's something that a lot of us haven't had to think about for quite some time, or maybe haven't thought about even when we were children. Measles is caused by a virus. It's simply called the measles virus. Before the vaccine, it caused about 500,000 infections in the United States. Most kids and actually most adolescents were immune to it or had it by the age of 15 before the 1960s when the measles eradication campaign started in the US. It typically will cause you to have fevers, chills, runny nose, cough, and then you get this rash. And that's how we typically will recognize that it's measles. And it's very contagious. And that's what really sets it apart, is that it's just so contagious. And then it can cause a lot of people to have problems afterward, like ear infections, pneumonias, things like that. And so we really want to prevent it.
One thing I wanted to talk about, because this is a thing that so many people have never seen before, is the complications of measles, because, you know, people, oh, it's just another respiratory virus.
Sure.
Why is it a big deal? So can you talk about some of like kind of worst case outcomes, like why we would want to prevent measles from spreading?
Yeah, so that's a great question. So the worst case outcomes are certainly death is the worst one, and we see about 1 in 1,000 people who die from measles. Most commonly it's those who are very young or adults actually as well, over the age of 20. So that's one that's of most concern to us, and unfortunately this year we've had one death in the measles outbreak in Texas. The other complications and the reasons people are seeking hospital care are pneumonias, and especially for little ones, dehydration. But they can get ear infections, and even after they have the measles infection, they can, their immune systems are just a little bit not normal, and they can get more respiratory infections, more GI infections, and generally just not do as well. So in addition to just the illness, which we don't want to write off as a respiratory illness, it can really cause some severe problems afterward.
One of the things that I had read about was that it can lead to deafness, which I presume is from having like a secondary ear infection.
Yeah, so deafness, you can also get a type of brain infection from measles called encephalitis, and even many years afterward, a very small percent of people will get a progressive brain problem from measles. All these contribute to hearing, to disability after having measles infection, in addition to the infectious parts.
Okay. And one thing that we kind of know is that measles was thought to be eradicated in the US around the year 2000. So why are there still cases today?
Sure, so around 2000 we had stopped transmission of person-to-person cases in the US. We still had some people come in and might get it, maybe had gotten it somewhere else, we'd stopped it, and that was because of vaccination. Vaccination is the key reason we were able to cut that down. And unfortunately, over the past 25 years, and in some part, I think we can blame COVID, we have reduced our rates of vaccination overall nationwide and internationally, and a lot of that's, again, partly due to COVID and lapse in vaccines, and measles will take advantage every time. It has such a high attack rate that if you let your guard down for just a second, and for us that means reduce your rate of MMR vaccine, it will take advantage and people will get sick.
And we're going to come back to the vaccine here in a second, but just to go ahead and put this out up front, there is not an outbreak in Kentucky yet.
Correct.
But do you want to talk about where the outbreaks are and then why we are still concerned even though there's not an outbreak here?
Sure, so right now we have an outbreak, as everyone's heard about, in western Texas that has affected New Mexico, Oklahoma, and parts of Mexico as well. There have been over 300 cases, about 40 plus have been hospitalized, and we've had one death. Very severe, ongoing, really is thought to possibly go on for quite a bit more time. The reason we are talking about it here in Kentucky is because it doesn't take much. Like I said before, people travel, we're a global world, we're not far from a lot of these states. People go places for vacations, to see family, and come back, and if they get exposed to it and they bring it to any state, not just Kentucky, it has a high risk of spread. Additionally, our vaccine rates in Kentucky are relatively low, so we are at risk for an outbreak because of that. But we do not have one right now.
Yeah. And you've mentioned how contagious it is, but just to put it in a little more context. So let's compare, say, COVID or flu and how that's passed compared to measles, because you had said you could be in a room hours after someone was in there and pick up the measles virus.
Yeah, so a good couple numbers that are quoted to help people understand how contagious measles is. One, the secondary attack rate. That means if you are in a house with somebody or in a dorm or a facility with somebody and there's people living with you, is 90% of susceptible people. Now, if you're vaccinated, that goes away. But if you're in a household and there's unvaccinated people, 90% of those people will get infected. A second number we look at is what's called the R naught, or the ability for the infection to spread to other people. And on average, measles, one person can infect 12 to 16 other people, just that one person. And that's because it spreads in these little tiny droplets and it stays in the air for a long time. And like you said, even after you leave a room for a couple hours, it's like the cologne or the perfume rule. You don't want it to stay in the room after you. Well, measles stays in the room way too long after you and then can infect many others.
Okay. And let's go back to the vaccine. So if you're thinking about how can you prevent measles, and the best way is
through the vaccine. So that's how, if you look at history books, as I mentioned before, 500,000 Americans would get measles before the measles eradication campaign, with 500 deaths a year. If you look afterward, when the measles vaccine started in 1963 and progressed on, the rates dropped by 95%. It is clear data that this vaccine works. And it evolved a little bit over the 60s and early 70s, but right now we have the MMR vaccine, which has been available in the US since 1971, is very safe, very effective, and it is the best way to prevent measles. And we can talk about how to give it, but that's just the take-home message of this is please check your vaccine records, check your history, and vaccinate your children.
And you had gone through this before. Can you kind of go through the timeline of, if you were born between these dates, you probably didn't get it versus getting the 1 dose versus the 2 dose?
Yeah, so it's an interesting, for us as doctors, we have to look at history more than medicine to really help people understand where they are in this timeline because of all the changes in how measles works. So the measles eradication campaign started in the early 60s and the first vaccine was in 1963. So if you go a few years behind that, in 1957, if you were born before then in the US, then you were more than likely exposed to measles because it was just, everyone got it. So you were considered immune to measles, or what we call presumptive immunity to measles, if you were born before 57. If you're born between 57 and 63, we really need to see if you've been vaccinated. And then if you're born between 63 and about 68, we would need to see what vaccine you got, because there were a couple of vaccines in that time, one of which was not terribly good, one of them was not bad, but it got changed to make it safer. After 1971, we had the effective MMR vaccine. Everyone got 1 dose of that as a child, and that gives you about 93% protection for life. And then after 1989, we upped that to 2 doses that we give, one around 1 year, one at around 4 years or so. That ups the protection to about 97%. For most people, if you're not planning travel, if you don't work in healthcare, if you're not attending or working at a secondary institution of education, such as this one, 1 dose is sufficient. But for all those other groups, we really want to see 2 doses of the MMR vaccine or a blood test that shows that you have protective antibodies for measles.
And just to clarify, because you've said MMR several times, what does that stand for?
I'm so sorry. Yes, we get so used to it. MMR is a combined vaccine, and it's measles, mumps, rubella. So it's 3 different types of protectants in the vaccine. There's actually one as well that has MMR-V, that has varicella or chickenpox as well. So kids can get that one, and that way it saves them a number of sticks because kids don't like shots.
Yeah.
So.
And it's considered just kind of a standard vaccination schedule that most children will get, correct?
Correct. That is, if you are following the vaccine recommendations from your pediatrician when you grow up, or your parents are, or your caregivers are, then that is part of the standard series. It is the one we give.
And if you are not sure, if you can't remember or your parents can't remember, what are the ways that you could try to figure out whether you were vaccinated or not?
So that's a great question. We've had so many questions from people that have tried to figure out if they got vaccinated against measles. It's tough. So a couple ways you can do it. First, obviously, if you're able to find your shot records, look for that MMR and then look for the dates. Really, if you've got one dose of MMR and you're not planning travel, you're not going to a university or some other secondary education, vocational school, something like that, or don't work in the healthcare field, that's probably sufficient for right now. There's no emergency to do anything different. If you see 2 doses, then you're good. Another way you can check is in Kentucky, we have, if you grew up in Kentucky and you were vaccinated here, we have a Kentucky immunization registry. So most healthcare facilities put in vaccines that were given across the Commonwealth of Kentucky, and your healthcare provider can check those for you. The catch with that is it started in 2015 and it only goes back to 2005. So if you were born before then, or got the vaccine before then, we don't always have the records here in Kentucky. The last option is to ask your care provider if they can do what's called a titer or a level. We generally would prefer to vaccinate you instead, but if you're looking as an adult, it's a tough conversation because it's unclear if all insurances will cover the MMR vaccine. It is a live vaccine, so it's worth asking your healthcare provider, because if you're pregnant or if you are someone who's immune compromised, it might not be safe for you. So have that conversation and they'll help you decide if you should get the vaccine, and just say, hey, it's safe, you probably got it, it's worth just giving it to you, which is always the better choice, or if maybe we should check a titer, which also might be important for your job.
And you've mentioned travel several times, as that's the way that measles frequently makes its way back into the U.S. But let's say you are traveling internationally, what is the best route to figure out if you need to check to see if you're immune against measles or even other vaccinations?
Sure. So I think the first stop is check with your primary care provider. They can, if you have lived or got your vaccines here in Kentucky, again, they can check that registry, and that's something you can just do and see if you've had it. Check your shot records with your family. If not, call and come see us. We have a travel clinic at UK for pre-travel. We're happy to go through everything with you, and that will include measles as well as other things that might help you, such as water safety and other precautions you might recommend for travel, but we can go through that with you here at UK.
Okay. And I think it's been about a month or so, but the Department of Public Health had put out a notice that there was a confirmed case of measles in Frankfurt, and kind of letting people know, like, hey, you were exposed. So just for future reference, if you think that you've been exposed to measles or have learned for sure, getting a notification that you're exposed, what should you do if you are unvaccinated?
Sure. So if you are unvaccinated and you get notified by the health department, they will track you and they will have you check in with them daily to track your symptoms and make sure you don't develop symptoms. And if you do, they will help direct you. Around this area will be to UK, and we can help you out. If we catch you within a short window of time, so say you're unvaccinated and we find out you were exposed to somebody with measles within the last 3 days, we can give you the vaccine and help prevent you from getting measles. Even within 6 days, the health department will contact us and let us know, because there's another medicine we can give you to help prevent you from getting measles as well. If you get past that 6-day window, it's a little tough, but we'll watch you and we can still take care of you. So the important part is to notify the health department, and I would say if you haven't been notified by the health department, or if you think you've been exposed to somebody with measles, call your primary care doctor and don't go in, just call them first. Exposed people are not infectious, but it's always better to let them know, because a lot of us haven't seen measles and they might want to do some research before you come in to provide you the best guidance.
Okay. And let's say if you've been exposed, should you let other people, like in your family, your friends, know as well?
Sure. If you've been exposed, I think it is, so exposed people by definition are not contagious. So you're safe to stay in your home environment unless you were to develop symptoms. The health department is really good with anyone, especially with measles and other diseases that have high transmission rates, of educating you of what you can and cannot do, or should and should not do rather. But you are safe to go around others unless you develop symptoms. I'm a big proponent of full disclosure, so I would always advocate for talk to your family, because it would feel lonely you might be scared. I mean, a lot of people get scared with all these things happening, so I think that would be an advisable thing to do. But you're not contagious.
Let's talk a little bit more about symptoms. So a lot of them are similar to any respiratory virus, but can you kind of take us through what makes measles a little bit different?
Sure. So the big things that we educate people on about measles are obviously the rash, and I'll talk about that a little bit more in a second, but it has what's called the 3 C's. So it's cough, coryza, which is a fancy term for runny nose that I think they just use to give another C, and conjunctivitis, which is red eyes. So you have to have that, fevers, and or the rash to really have a probable case of measles. So what happens typically in the first few days is you'll get the cough or the runny nose or the red eyes, or all together. You'll get a fever that kind of keeps going, and then about day 4-ish, you'll start developing the rash. The rash starts around here on your head or behind your ears, and then will spread downward. The tough part is in somebody that is pale-skinned like me, it would be very apparent to see the rash. It's red, you'll see bumps, they'll kind of come together as splotches and maybe have some dots. It doesn't typically itch too bad. In somebody who is darker skin or somebody of color, it might be more faint. We have to look very carefully and see if we just see light bumps or darkening of the skin to really see if that rash is there. And that's usually what tips us off. So it's good for us to recognize how rashes appear on all skin types and make sure we're thinking about measles. That being said, there's a lot of diseases that can cause fevers, cough, and rash. We've probably all had one in this room. And so we have to be careful to distinguish those from something else. Hand, foot, and mouth disease is a good example. It causes rash on the hands and fevers and things like that. There's a few others.
Are children more susceptible to developing harsher symptoms because of, their immune systems, or?
Yeah, that's a great question. So with measles specifically, children who do not have adequate nutrition status, and specifically younger children under 6 months, are at higher risk for complications of measles. So definitely the younger kids, and certainly any child who is born with a immune deficiency or a weakened immune system in some way, or has another chronic condition, might be at risk for more complications from measles. But as a blanket, kind of all children, not usually, but it depends on the age.
And you mentioned earlier pregnant women being kind of at
Yes.
or other adult populations, like other specific like medical conditions where we'd really be concerned if someone contracted measles.
Adults in general, when we look at the data, when you see who gets hospitalized more, it's adults who are unvaccinated over 20, anybody who's pregnant, anybody who has immune compromise. A lot of people, especially in this day and age, are on medications that alter their immune system for chronic medical conditions. They could be more at risk, and we want to make sure we vaccinate them or check their immunity before we start those medications. And that's one of the things that our colleagues in dermatology, rheumatology, and gastroenterology are really good at for people with chronic conditions.
So at what point, if you're unvaccinated, you think you have the measles, would you maybe call your primary care doctor versus thinking maybe I should go to the emergency room?
Sure. So, the first step, if you think you have the measles, and I will say right now, if there was a new case, it would be tough. Most of the time, we find out about measles cases, or people think they have measles cases because there's a known exposure, because really we start looking at outbreak when there's just one case in a hospital. And in a community, we take them very seriously. So usually you get a lot of people notifying you once there's one known case. But if you weren't aware of an outbreak and you think you might have measles, the biggest thing I can tell you to do is call ahead. Because if you were to go into an emergency room, if you were to go into a clinic, it could infect so many people. So call ahead. They'll have you discuss your symptoms. We can do so much with telehealth now. And that will give your primary care provider a chance to call one of us on UKMDs, talk to us about the case and see what the best guidance is, interface with the health department, who are real experts and who we rely on for testing. When you should go to the hospital, and I would recommend still calling ahead. If you're going to go to the ER and you're sick, you should, and I'll tell you why, but call ahead first, and they'll give you some instructions on what to do for yourself or for a loved one if it's a child. For a child, signs of dehydration. If they're not eating, they're not drinking, They're not peeing and pooping normally. And their cry gets weaker. They need to go to the emergency room and be evaluated. Dehydration is one of the top reasons for hospitalization. Again, call ahead first. For adults, dehydration is still there. Pneumonia tends to be one of the reasons that gets us to go to the hospital. You're unable to breathe well. You're not keeping down fluids. You're not able to just take care of yourself at home. That's when you need to go in, but call ahead first. And if you're someone that can wear a mask because that just really helps reduce the spread. Obviously, little babies, you can't put a mask on them.
And talk a little bit about, so if you've been exposed to measles, you're getting sick, it's too late to get the vaccine to kind of completely prevent you from getting sick. But what is like a treatment like for a non-life-threatening case of measles? We'll say, can you treat it at home?
Yeah, so there's really no, unlike for flu or COVID where we have some treatments we can give, for people that are not hospitalized, there's not much we can give other than telling you to do the same old stuff I'd tell you to do for any other infection. Hydrate, keep eating, watch your symptoms. Stay in isolation would be the other one from a public health measure. But really try to keep yourself hydrated, treat your fever symptomatically, and rest, and you'll get better in most cases. So that's the good thing is, for most people they will do better. But we want to really try to, on the forefront, prevent any possible illness that becomes severe. But yes, if you get it, the chances are you're going to do well. Hydrate, medicines for fevers, eat like you normally would, and we want you to stay in isolation for at least 4 days after the onset of the rash. So when the rash starts, that's day 0, and then you count 1, 2, 3, 4, which I think all of us are used to with COVID isolation stuff. Mm-hmm. We've gotten good at counting these days, but that's when you can come out as the 5th day after. If you're immune compromised, talk to your healthcare provider first, and they might give you a little bit different advice, but that would be the general recommendation.
Okay, and just to be a little more specific for resources on campus, thinking about our students and our employees, if you haven't gotten the vaccine yet and you want to,
Sure.
What are your options?
Yeah, so the pharmacies across campus, the apothecary, the Kentucky Clinic, for example, they have the MMR vaccine. We're fortunate here at UK to have access to it. Some clinics don't, especially if they see mainly adults, they don't stock it always. But at UK, we're really lucky. Our UK retail pharmacies are amazing, and they have the vaccine. They can vaccinate you. Talk to your student health provider. If you're someone here and you go to UHS, University Health Services, they can help guide you on the best path, or they can look up and see maybe you did get a vaccine dose and you might not need it, or you might need a second dose, and then we can help protect you. So I think having that conversation is the most important. If you feel like, especially with lots of people traveling for spring break or even this summer, going to wherever their home is, or maybe taking a trip, even people study abroad, things like that, check in with student health before you go. Take care of everything pre-travel. We can help you in travel clinic if needed. And then if you come home and you feel like you've been exposed, call ahead.
And just to kind of finish up, is there anything else that you would want either the campus community to know, our students, or just the community at large about measles?
Yeah, I think the take-home point of this and what I really want to stress is awareness of how vaccines have really helped our country, helped our children, and helped our communities, specifically the MMR vaccine, but really any that we recommend. We don't want to see these cases here. We don't want to see these cases anywhere. We definitely don't want to see them here in Kentucky. And I think if people can go out and educate their friends, say, hey, the MMR vaccine's safe. It does not have severe side effects. It is a way that we can prevent children from dying, and even adults from dying. And encourage people to talk to their pediatricians and get their childhood vaccines. We will raise a safer generation going forward. And that's what I would really like to see out of this measles conversation, not just for measles, but for other vaccine preventable illnesses too, because healthy children lead to a healthier Kentucky, leads to better lives for everyone here and abroad.
Okay, well said.
Right.
Thank you so much, Dr. Van Sickels, for joining us today, and thank you all for tuning in.